Good morning, friends, teachers, parents, and dear children. First of all, I would like to thank our director, ma'am, Mrs. Rupa Chakravarti, for giving me this wonderful opportunity to connect with you. I'm Dr. Ashish Lall. I'm a practicing eye surgeon at my own hospital, Lal 2020 Eye Care, which is a part of Lal Hospitals at New Railway Road, Gurgaon. Today, in this COVID era, digital media is the only way to get ourselves educated, to recreate, to communicate, and to do our professional work. In this presentation, I'm going to tell you how to use the smartphones, the laptops, and the digital technology in the smartest possible way without affecting your eyes. Friends, digital world is a necessary evil. Our children, our next generation, question us whenever we ask them to improve a habit or to change a habit. So in this presentation, I'm going to talk about the scientific aspects as to how the digital world, the digital media affects our eyes, and I'm sure with the logic, the children are going to adopt better habits and improve their vision. My talk is going to be in three parts. The first part will be the spectacles. Why is there an increased incidence and progression of eye power in children? The second part will be the computer vision syndrome or the digital eye strain. And finally, the ergonomics of using the digital media so as to prevent backache, neckache, etc. I'll be talking on why and how the eyes are affected, and finally, how we can minimize the damage or the solution. One of the most important problem is the spectacles. The parents come up with various questions. Why did my child get it? Can we get them removed? How can we make it stable? Now this question is one of the most important things. In fact, this is one of the most important problem that the children are getting. They are getting spectacles, the power is increasing day by day, and now I'm going to delve into the problem as to why this is happening. As we move on to the questions of spectacle, first of all, we need to know as to why is this happening. If you look at emetropia, what is emetropia? Emetropia is a normal eye where the light focuses on the retina. While in a myopic eye, which has minus power, the light focuses in front of the retina. It should focus here, but it is focusing in front of it. Now, why is it so? Because there is an increased eyeball length more than what it should be. So whenever there is an increased eyeball length, there is myopia. And here we need to use minus glasses. These minus glasses divert the rays and the image is formed on the retina. So why does the eyeball increase in size in some and not in others? Why spectacles? Why an increase in eyeball length? Most important answer that we all have is genetics. My mother has it, my father has it, so I also have to have it. And it's very right, genetics play a very important role. But now, today, the environment, the man-made factors are also as important as the genetics. These are important because we can take care of them, we can modify them. Now, what environmental factor causes spectacles? Now, look carefully. Whenever we do a lot of near work, this causes an excessive eye muscle use, which leads to an increased eyeball growth. Now, this has been proved in various studies. Here is the eye muscle, and this contracts when we use close focus. So, too much of close focus will cause too much of contraction, which is going to cause an increased eyeball growth. Now, as I told you before, whenever there is an increased eyeball growth, there is going to be a myopia. The image is going to be forming in front of the retina rather than on the retina, and we are going to be using minus glasses. So now the question, what are the solutions to prevent the spectacles or stabilize or minimize the increase? Step number one is minimize near work. Now, what is near work? Schoolwork and studies are essential, so obviously they have to be done. So you have to minimize what is non-essential near work. I repeat, non-essential near work, and that is for you to figure out what is non-essential near work, and this is more important for people who have high-powered minus lenses. The second important tip is that computer or laptop or phone usage should be done only for studying, especially when you use them for 3, 4, 5 hours. Now, this is important. Once you've used digital screen time for 4, 5 hours, I would suggest that don't use them or use them minimally. And this is important, especially again for patients who are myopic. Another important thing that we need to know is the twilight. Studying in twilight is supposed to be good for eyes. Use your balcony or terrace to spend quality time reading or looking at distant objects. This will help you stabilize your vision. Again, quality time playing outdoors relaxes your eye muscles. If possible, 1 or 2 hours every day is very healthy for the eye. Now, when a student has spent a lot of time studying digitally, I would recommend video games, movies, social media to be restricted to not more than 1 hour on school days. And nowadays, especially when the child is busy with the computer, please avoid non-essential screen time. Certain medicines like low-dose atropine has been known to decrease the rate of progression of myopia. These causes relaxation of eye muscles, which leads to decreased growth of eyes and hence stabilizing the power of the eye. These eye drops are usually used today, usually at bedtime for 2 or 3 years. It should be used under the supervision of a doctor. Important problem is computer vision syndrome or digital eye strain. The common symptoms include eye strain, headaches, blurred vision, dry eyes, neck and shoulder pains. Now, why is this there? It could be due to poor lighting, glare on a digital screen, improper vision distances, proper seating posture, or uncorrected vision problems. Try and figure out which problem you have and then find a solution. The level of visual disability and the amount of time that you spend on a digital screen is very, very important. Please get your eyes corrected for farsightedness, astigmatism, eye coordination abilities, because once you have these problems, the digital strain will be too much. Finally, 20-20-20 to prevent digital eye strain. Now, this is a mantra. Take a 20-second break every 20 minutes. Look at something 20 feet away. So 20 second की break हर 20 मिनट बाद and look at something 20 feet away whenever we are spending long hours on computer. Increase the font size. Now, what does this font size increase will do? This will relax our eyes and our eyes will not be tired. The third important tip is that minimize video games because they increase the screen time too much. The child does not even blink his eyes. Please encourage board games and reduce video games to a minimum. Now, what other ways by which we can reduce the screen time? We should use it mainly for school classes, minimal TV or no video games on school days. On non-school days, they can use it for some time. Novel and leisure reading should be restricted to non-school days. This is how you have to reduce your near work and you have to reduce your digital screening time. Move on to the next tip, which is tip number 7. Our children are very naughty. They'll say, I just use it for 5 minutes, WhatsApp, but the cumulative amount of digital time we can actually check on the phone as to how much the time has been spent on Instagram, WhatsApp, etc. How much is the screen time? So this will be very effective in actually knowing as to how much time the child spends on the phone. Friends, blink rate is important. Do blink during the viewing of computer because it minimizes the dry eye. It keeps the eye moist. And Finally, you can use some medications. Use of various tear substitutes like Refresh Tears, Hylo Tears, Cysteine Ultra can be used to prevent dry eyes and to reduce the digital. We can also use anti-glare glasses and screens which help us in reducing the stress of the eye. Now, I would say that most of the people it is temporary, it declines after stopping computer work or the use of digital devices. If the problem is not addressed, please contact your ophthalmologist because there can be some organic problem which is causing. Finally, the need for a good sitting posture. Your eye level to the screen is very important. The way you sit, the way you actually sit on the chair, look at the screen. This will help your backache, your neck pain, and you can, this goes a long way, especially for adults. The correct ergonomics of viewing a, computer cannot be overemphasized. I am not going into the details as to which exercises you should do, but we can always come back sometime later, and this is a big topic and we can come and cover this topic with some orthopedic doctor as well. And we move on to the last slide, friends. All that I have said, I remember this beautiful quote of Swami Vivekananda who said, what is a bad habit? Anything in excess is a bad habit. I would say digital media is important. We need to use it, but we need to use it in moderation. We cannot use it going on and on because then our eyes will be badly affected. So use it in moderation, use it smartly, and that is the key to success. Finally, dear children, we love you. We want you to adopt good habits because that will go a long way. Thank you. And I would like to acknowledge my whole team for giving their inputs for this presentation. And finally, the three kids from Suncity and from my family, Arush, Arin, and Arika, for helping me out with this presentation. And they were very excited when I got this opportunity. Thank you very much. And finally, friends, time to say goodbye. You can give me your questions and I'll be more than happy to answer them. You can WhatsApp me at 93129 or email me. Thank you very much. And thank you, Suncity, for taking me on board. Thank you very much.